Good morning, everyone, and welcome to another Health Ministries presentation on menopause. Oh, my word, you must know someone who is in it, been through it, or coming up on menopause. A mother, a sister, a girlfriend, fiance, a wife, a boss, right? We know someone on menopause who's going through menopause. So please, tell them to come and listen, link it to all your social media because it's going to be a wonderful presentation by a former guest, Dr. Jacqueline Williams Olongo. She is back with us to give us tips and educate us on menopause. Let's open with a word of prayer. Father God, thank you so much for all that you have done for us throughout the week in our lives. Please be with everyone under the sound of my voice. Give them a special blessing. And please also bless Dr. Olongo and her family for her willingness to share with us words that you have given to her. Please keep our ears open and available that we are able to hear and incorporate this into our lives. In Jesus' name I pray, amen. So let me introduce once again Dr. Jacqueline Olongo Williams Olongo, my bad. She is a board certified OBGYN, graduated from Loma Linda University, and currently in private practice. Please welcome Dr. Jacqueline Williams Olongo.
Good.
Hi.
Hi, and good morning. Thank you for having me back on. And I want to welcome everyone here. And I hope that this information will be useful for you ladies and for the men who are listening to help you to understand what your partners are going through. So, as mentioned before by our moderator, we're going to be speaking about menopause, and it's something that all women will experience or have experienced. And unfortunately, it's unavoidable, but it happens, okay? So for most of us in our menstrual life, let's see, most of us in our menstrual life, we have the experience of a menstrual period. For some people, the menstrual period is a walk in the park, but for many people, they end up feeling miserable for several days each month. Either they're crying and bleeding, something's going on, and just life just isn't worth living for some of them. So for other ladies, their menstrual period is like this. It's just like a little blip and nothing happens. So let's see, what exactly is menopause? Well, menopause is the end of a woman's menstrual cycle. You have periods that stop for 1 year, and that's how you know the term menopause. And it usually happens naturally around age 51 for women in the United States. So in other places, it may happen earlier or later, but we're just going to talk about the age for the women in the United States. It is the end of fertility. So once your periods have stopped, you will no longer be able to have babies, and it can be surgical, medical, or natural menopause. So let's rewind a little bit. Since menopause is the end of our menstrual cycle, let's talk about our menstrual cycle. So at the bottom of this diagram, you'll see what's happening. So the menstrual cycle isn't just, okay, I'm bleeding and that's it. It actually is going on in several parts of your body. So here at the bottom, you can see that this represents the uterus. And so on the day that you start bleeding, that is day 1 of your menstrual cycle, your uterus is releasing the tissue because fertilization did not occur. But in your ovary, on the day that you start bleeding, the ovary is picking up and selecting follicles or eggs that may become fertilized in the next 2 weeks. So while this is happening, your ovary is like, okay, I'm getting ready for the next baby that may happen. In your brain, you have hormones being released, and you've seen FSH before, possibly probably looked at one of these diagrams. That stands for follicular stimulating hormone, so it's stimulating follicle development, and a hormone called luteinizing hormone, LH, and that helps to sustain the follicle until the placenta forms if you were to become pregnant. Okay, and in your body's temperature regulation, what's going on is that your body is staying at a cool temperature, and then once you ovulate, your temperature stays up, and it stays up until you have your next menstrual cycle. If you don't have a menstrual cycle and if you were to become pregnant, your body temperature stays up. Pregnant women often complain of being warm. Okay, so now that you understand what's going on inside of your body normally, let's see now for menopause. How will you know then? Okay, well, the most accurate way is to watch your menstrual cycles for 12 months in a row. So once you start noticing, oh, my cycle's getting a little bit irregular, you should start documenting it, because a regular transition into menopause should involve periods that are spacing out and getting lighter. However, for some women, their periods actually become more irregular and closer. And for periods that are becoming more irregular, closer, and heavier, you actually need to speak to your physician. Because while this may happen for some women in menopause, it doesn't mean that it's completely normal, because there's some conditions that are abnormal that can trigger this same type of situation. So we mentioned surgical, medical versus natural menopause. Surgical menopause occurs when you've had a hysterectomy and an oophorectomy. So the oophorectomy means removal of your ovaries. So once your ovaries are removed for any reason, that will put you into menopause. Medical menopause may occur for women who are on chemotherapy or on other medication that affects their ovarian function. And we've been focusing on the natural menopause. So the first sign of natural menopause for most women is the irregular menstrual cycle. And in the US, it commonly happens around age 47. However, for some women, they may start noticing the irregularities after age 40. Okay, so normal menopause happens after age 40. Menopause that occurs prior to age 40 is called basically premature ovarian failure, but we're not focusing on that at this time. So usually, so I'm giving you more of the average situation. Usually your irregular menstrual cycles last about 4 years, and that will end up placing you at the 51 years of age when your periods will stop. So what are the symptoms of menopause? Hot flashes. Hot flashes are the most common symptom of menopause. And leading up to when your periods stop, you may start having hot flashes. In addition, you may have night sweats. So night sweats are the hot flashes that wake you up at night. Mood swings. Mood swings often happen because you're not sleeping well and you're having trouble sleeping, and so you're irritable, and therefore you end up having a mixed bunch of emotions and you tend to go to work unhappy. Okay? Sleep deprivation is a form of torture. It has been known to cause psychosis, and it has been known to cause depression. So this doesn't mean that you're crazy, it's just that you need more sleep. So what's going on? Why am I having hot flashes? Well, there's a decrease in estrogen, and the decrease in estrogen decreases a signal that's going to your hypothalamus, and that is your body's basically your body's thermostat. And so slight changes in temperature are registered as abnormal, and so your body overreacts, gets you a hot flash, and then you want to cool down. And the cooling down is the sweat that comes with, or perspiration that comes with the hot flash. Okay? Other symptoms: vaginal dryness, painful intercourse, a lower sex drive. Why am I having pain with intercourse? Well, once again, the low levels of estrogen are affecting your vaginal lubrication. Estrogen helps to encourage vaginal lubrication. It also helps to keep the vaginal mucosa nice and pliable and more elastic. The decreased levels of estrogen encourage drying, and this is known as something called vaginal atrophy. So, just a side note, the vagina, when it's young, has what are called rugae. So think of them as ridges or folds or wrinkles. Think of an accordion. So the vagina is more like an accordion at when it's younger. So that's the only part of your body that has wrinkles when it's young. Okay. And as you get older, the lack of estrogen causes those ridges or folds to start to flatten out, and it becomes flat and smooth and tight. So for whatever reason, God wanted to create us that as we got older, everything else would sag, the vagina became tighter, and here we are. And so you end up with discomfort and pain with intercourse. Where is my sex drive? Well, usually because of the decrease in estrogen, the vagina becoming tighter and drier causes sex to become uncomfortable. When sex becomes uncomfortable, the brain registers it as a problem and it wants to avoid it. The other side of it too is that women tend to become physical as they become, and happiness to state of not feeling desirable. And if you feel less desirable, you will feel ready to have intercourse with your partner. More symptoms: weight gain, hair thinning, growth of unwanted facial hair. So why am I gaining weight? So as we get older, the the activity level goes down. Research has been shown in some mice that a lack of estrogen triggers their, basically, normally estrogen binds to a certain receptor that encourages movement. And what happens is, as you drop your estrogen level, you have less of that motivation to move because you're not getting that stimulation from the estrogen. Hair thinning, common problem. So estrogen and progesterone actually work to keep your hair. So hair loss during menopause is a result of a lowered production of estrogen and progesterone. These hormones basically help your hair to grow faster and to stay on your head for longer periods. When the level of estrogen and progesterone drop, the hair grows slowly and becomes much thinner. On the other side of it too, as far as the facial hair, women naturally actually make testosterone, but because your estrogen levels are dropping, but your testosterone level is somewhat unchecked, that's why you may start to notice the facial hair that is unwanted. So, what can I do? There are many therapies that are out there to reduce menopausal symptoms, and they're prescription based therapies. Estrogen and progesterone can come in a pill form, a patch form, injections, gels, drops. Those are the prescribed forms of therapy. And so for women who have their uterus intact, so they still have their uterus and they're experiencing menopause, estrogen and progesterone are the recommended therapies. The progesterone is there to protect your uterine lining from becoming cancerous. Estrogen only based therapy is for women who no longer have a uterus, and so they can just use that and it will help their hot flashes. The recommendation is that patients should receive the lowest dose for the shortest length of time. And this information is based on the WHI study, so the Women's Health Initiative study. This was done in the early 2000s, and basically what they did was they had two arms. One arm of the study dealt with women who were on estrogen and progesterone, and they had the women who were on estrogen therapy, and they compared both of them to women who were on placebo. And what they found were different things. So as far as risk were concerned, women who did not have a uterus and only received estrogen therapy had a lower risk of breast cancer than women on placebo. Local menopausal hormone therapy is prescribed to treat vaginal symptoms. So if you're just having vaginal symptoms, you can just have local or just basically a vaginal estrogen cream. But as long as you have your uterus, you need to have estrogen and progesterone if you're going to be taking a tablet, a patch, any of those other things. And in addition to that, for women who were on hormone therapy, there was an increased risk of strokes, heart attacks, and clotting disorders. Women who took estrogen alone were basically safer in the study. They had less risk of just breast cancer. Other therapies. So you can also take antidepressants, so selective serotonin reuptake inhibitors, SSRIs, are often used to help women who don't want to be on hormones but are having primarily mood symptoms. So if your main issue with your menopausal transition is the mood disorders that develop, you can also have the side benefit of treating hot flashes as well as your anxiety and depression. Non-hormonal vaginal moisturizers and lubricants can also be used. One over-the-counter therapy is called Replens, and Replens will give you about 72 hours of moisture. And the same company that makes Replens makes Refresh, and for some women who have vaginal dysfunction, Refresh is something that helps their pH. Okay, so as mentioned before, there are low-dose estrogen-based low-dose estrogen-based vaginal lubricants as well as over-the-counter therapies. They can come in creams, they can come in a ring, or they can come in a tablet. You can speak to your doctor as to which one works best for you, but a lot of the times the decision is made by your insurance company unless you want to pay out of your pocket. Another medication that's used for vaginal dryness is it's called, the name brand is Ospina. You've probably seen the commercial for the vaginal dryness, and it helps with painful intercourse. Because women are older and their vagina is shrinking and getting tighter, it makes it easier for bacteria to get into their bladders. So some women have to be on antibiotics regularly because they develop infections with intercourse. And because of the sleep disruptions, some people do have to go on medications for sleep because of the night sweats. Things that you can use over the counter. Some people swear by essential oils. Some people use Benadryl because it's non-addicting and allows you to be able to sleep. There's also melatonin that can be used 5 milligrams daily, non-addicting as well. Or you can go on trazodone or Ambien or some other medication prescribed by your doctor. So the non-prescription based therapies usually are phytoestrogens. So phyto means plant, estrogens. So plant derived substances that act like estrogens in the body. Black cohosh and other soy-based products can be used. Maca root is an herbal remedy that has been shown to be good for some people with reproductive issues. And Bonafide is a company that makes this line of products. If you were to go online, you'd be able to find their products. This company has non-hormonal therapies that can be used for many of the different issues that come up with menopause. So, what about the hair loss? Well, there is Rogaine. It can be purchased at Costco, at Walmart, anywhere. It can be purchased in many places. It can be used as drops, as a foam, or a shampoo. When using Rogaine, it's used daily for hair thinning and hair loss. It has to be used indefinitely. Once you stop, you will lose the benefits of it. Another thing that changes with time is dandruff that may happen with the aging process, and these can also be purchased at your local store so as you can see here, ketoconazole and zinc, you can use them on your scalp. For the hair growth on your face that you do not want, Vanica is a product that you can apply. It's great for treating unwanted hair growth. However, it slows the hair growth, but the benefits are lost after you stop, like times 8. So after 8 weeks, you'll go back to whatever was going on before. So, how can I improve my libido? Well, for women who are having libido issues because of body image, exercise and a healthy diet can help. But the other benefit of exercise is that when you exercise, you actually release endorphins, which are your body's feel good hormones. And once you start to feel good, you will be more likely to want to engage in intercourse. The other thing is communicate with your partner. He does not have a uterus, he does not have a vagina. He does not know, he can empathize with you, but he does not know what you're going through. So verbalize with him what you're feeling, and then you can figure out what you can do to make your intimate life better. And also, you can always speak to your doctor. Your gynecologist is there to help you, and he or she has many things that can be offered to help. Aging is natural, and we can try to basically offset some of the discomfort. We can't change everything, but we can help to make it a little bit smoother. And let's talk about menopause and the bones. So we've talked about other things. The main effect of estrogen is to inhibit bone remodeling. So as we age and we're losing estrogen, there is a lot of breakdown going on in the bones. And so you can use estrogen and progesterone when you use the therapy to help prevent bone fractures. However, there are other hormones, non-hormonal things that you can use that can be prescribed by your physician. And here's a list, and your doctor can go over that with you when he or she does your DEXA scan and lets you know what is your risk of fracture. Menopause in the bones, once again, here we are. So you can have healthy, strong bones, but you need to start exercising, doing everything before age 30, because that's when you are basically putting money in the bank. After age 30 is when things start to get lost. So calcium intake, you don't have to necessarily take calcium tablets, but you should have a calcium rich diet. Eating it is better than taking the tablet. So broccoli, lots of things basically will help you with your calcium intake. If you're a smoker, please quit smoking. Weight-bearing exercises that help to strengthen the bones, so walking, so jogging, things like that. Weight-bearing exercises help. Maintaining a healthy body weight. So in this situation, the thinner you are, then you have less bone reserve to draw from as you age. So basically, maintain a healthy body weight. Avoiding alcohol use is very important because this too can affect your bones. Another thing that you should do is add vitamin D if you have not been taking it. It does help your immunity, but it also helps your body to absorb calcium. And for any questions that you may have or more information, I'm going to leave this slide up here to let you know these are sites that you can go to that give you honest, reputable, science-based information on what you can do to help you through menopause. And I'm open to any questions at this time.
Good. So thank you so much, Dr. Olango. That was a great presentation. I had moments throughout your presentation that my heart nearly stopped. It was like, hair thinning too. All these things that that can happen as we age. And so we have a few questions. Folks, feel free to put your questions in the chat. Um, we're happy to answer those questions as they come along. And so, one of the questions that we have is what age basically is early menopause? Is it a bad thing to be in early menopause before 50?
So it's bad in the sense that you're going to be feeling the symptoms at an earlier age, and your bones will you'll start having bone loss at an earlier age and vaginal dryness. So all those symptoms bad in that sense. But as far as your overall health, if you're maintaining a healthy diet and exercise, your aging is going to happen to all of us. If a woman were to have menopause at less than 40, that's when we have more concern. But after 40, 40 to 45 is considered early menopause, and 45 and on is more common.
Oh my. So, in thinking about what you were saying about exercise by the age of 30 for bones, once we're 50 and we're in menopause, can we regenerate our bones if they've already told us we have bone loss or bone thinning?
No, you are not necessarily regenerating your bones, but you're stopping or slowing the process.
Oh, okay. So it cannot be reversed after we're in menopause. We
Once
can
you're,
just,
yeah, you can just
oh,
slow the process.
oh my. Well, folks, ladies, my goodness, we have to get on it. We need to be sure that we're exercising before 50 so that we can keep our bones and then continue exercising afterwards also to keep them strong. And now we had a question here about fibroids. Can you replace hormones? Or I think the question is, can you use hormone replacement therapy if you have fibroids?
You can. You
It will
can.
not it will not increase the fibroids.
It will not necessarily increase the fibroids. You may have more incidents or episodes of irregular bleeding than someone who's not on hormones, but it won't necessarily. I'm thinking, I'm reading between the lines. The person is concerned that their fibroid may grow because they're on hormones.
Right.
So that's
I
not
see.
so much the issue. It's more so bleeding.
Ah, I see. Very good. Now, another question is, I heard estrogen replacement can cause breast cancer.
Okay.
So I
So
guess they're wanting clarity on the replacement therapy and breast cancer.
So I'm giving you facts. So I think you still have this slide up that I have. So the
Yes.
WHI study found that women who were just getting estrogen replacement therapy had a less chance of breast cancer than women who were on placebo. For women who have their uterus, they would have to have estrogen and progesterone. So the women who are on estrogen and progesterone, their risk of breast cancer was higher.
Oh,
So
okay.
just estrogen by itself. So, research is ongoing. They're still following the women. It's been years, but they're still following the women who were involved in that study. I
Okay.
don't know if
So
that
then
answered the question.
I believe so. So estrogen by itself um, can, no, estrogen by itself can increase breast cancer, but estrogen and progesterone. Can keep
No,
it steady? No?
no,
Okay,
no, no.
clarify.
So estrogen alone, not have a uterus, they're just getting that they're the research has shown that your risk of cancer, so the WHI study says that your risk of cancer is less than someone who's on placebo even. So you still have a
Okay,
risk of breast
very good.
cancer. So they're not
Mhm.
taking, you're not getting off the ship and saying no breast cancer for me, but for women who are on estrogen and progesterone. So an estrogen and a progestin therapy, combination therapy, they're the ones that are increased risk of having an advanced cancer. So combined
Eh,
hormone therapy.
I see. Very good, very good. And then the next question here is, over the counter, there are many natural progesterone supplements. How does that help my estrogen levels?
They don't necessarily help your estrogen levels. What they do is they help your symptoms because they act like estrogens in the body.
Oh, I see. And then on one of your slides, you were talking about phytoestrogen
Correct.
in a natural product. Does that come also in foods? Are there certain foods that we can eat that naturally occur with the phytoestrogens?
Soy, flax, soy and flax are some foods that are common foods that people can eat.
Oh, okay. Very good. Yeah, a lot of the natural progesterones are made of soy, aren't they?
Some are from yams.
Okay. What are your thoughts on estroven as a supplement?
So estrogen is a soy-based phytoestrogen. So it's a soy-based plant estrogen.
Mhm.
And the way I approach it is that if that works for you because you're the one having those symptoms, I say go for it
Oh,
and
okay.
use it.
Good.
And there are people who oppose soy, and that's another argument for another day. But I'm just letting you know, for me, if that works for my patient, I say go ahead and use it.
Okay, very good. And then this question is on periods. So, if the patient is saying, can we use hormone replacement therapy if we still have periods but have hot flashes and night sweats? So, I guess they're saying they're not quite in menopause and what they can do about the hot flashes and night sweats.
So there are lots of different options. So for some people, so if I were to have a patient who was age 45 and having hot flashes and night sweats and still having menstrual cycles, I would even put her on birth control
Oh,
because
really?
yeah, you can use birth control up until age 51 if you don't have hypertension, liver disease, and clotting problems. So that way it would cover her for contraceptive therapy. It would cover her for, give her some relief for some people for their hot flashes and would help to control the period problems that they're having.
Okay. Until what age can you use the um,
Birth
birth
control,
control? Yes.
age 51 if you don't have the other issues. So high
Oh,
blood pressure, clotting disorders, liver disease.
okay, excellent. Now, do
So
you
that's for that.
have
I'm saying for that's for that person. So that's it's an individual. There's no cookie cutter thing for everyone. Each person's situation can be dealt with individually.
right? I was just remembering back in the day in school, they would always tell us up until 40, 45 for birth control, but I had understood that that had changed.
Yes.
So now 51 or so. Okay, sounds good. And then one of the other questions that we had, um, I think you already answered it. Are there natural ways to increase estrogen? How do I know my estrogen levels and is it important?
So if you wanted to check your estrogen levels, you could, but technically in practice for many doctors, when we draw blood work, we're drawing blood work or ordering tests, I should say, when we order tests, we're ordering tests to find out if something's wrong, if it's something that we can fix. If a woman were to come into my office at age 47 with menopausal symptoms, drawing her estrogen level would not give me any information that I don't already know. I know that she is heading into menopause, and if I draw her estrogen level, it's not going to change my therapy or my recommendations for her. I'm going to let her know she's heading into menopause and that these are things to expect and which symptom is the worst for you and what can we do for that symptom and which therapy option are you comfortable with going forward with? So checking your estrogen level doesn't do anything. And I know that there are clinicians who do check it, but it's not necessary in my practice unless I'm concerned you're 18, you stopped having your periods and you're not pregnant, what's going on? That sort of
Exactly.
thing.
Oh, very good, very good. Okay, and then our last question here. Oh, this is interesting. Do you have any other tricks to preventing hair thinning?
Tricks to preventing hair thinning
Yeah.
outside of the ones that are mentioned there. Well, something that people may not be comfortable with, stop coloring your hair.
Oh, okay.
That's one, because that weakens your hair. Two, avoiding weaves, things like that, because you're
Wigs,
putting
did you say?
weaves,
Oh, weaves.
we-
Uh-huh.
things that basically things that put traction on your hair, not just weaves, but
But
anything that
braids and
causes, yeah, that causes traction on your hair because it's weaker, and so you're going to make the process more rapid.
does the menopause cause a weakness of the hair strand so it's breaking more often, or is that because of how we're eating?
Well, eating better does always help with hair loss at any age, but estrogen and progesterone, as I mentioned on one of my slides, help your hair to grow and help it to stay on your head. And if the estrogen and progesterone are decreasing, your hair becomes thinner and it doesn't want to stay on your head. And so, if you're putting weight on it and pulling it on hair that's already
Mm,
thin, then it's going, or thinning, I should say, is
right,
going
right.
to want to break off. But
Oh, I
eating is always eating a healthy diet for so many of our issues is always important.
see. So the bottom line, eating well every single day is the
Yes,
most important thing that we can do for our bones
correct,
and for our hair and even for some of the symptoms, right?
correct.
With that. Oh, that's a good takeaway there. So we're about ready to conclude here.
Mhm.
Oh, we have a question here. What test can be done to know if you are in menopause?
Okay. So if you were to come into the office and you had stopped having your period for 12 months straight, I would not need to do a test. If you're over age 40, I would assume that you're in menopause. If there's a question um, as to whether or not you've gone into menopause, the issue is drawing your blood may or may not be helpful. If you stop having periods for 3 months, and if I were to draw your blood, it could show that your estrogen level was a little low, and your FSH, which is a hormone that your body makes and that goes up in menopause, it may be not too high, but then 6 months later, your numbers may be up. So we wouldn't know if we were catching you in the transition into menopause or out of it, because your numbers go up and down. So to simplify it, the bottom line is your ovarian function goes up and down until you've gone into the solid 12 months of not having a period. So if there were a test that you wanted to get to see if you were officially in menopause, the FSH would be the best one. But at the same time, your clinical presentation is a better test. If you haven't had a period for 12 months and you're in the right age group, you don't need to spend your healthcare dollars on a blood test. If you are 35 and not had your period for several months, that's when I would say let's check, because it shouldn't be high at that point.
Okay, very good. So the FSH is one of the number one tests,
Correct.
but just how we come in and our symptoms is actually the
Correct.
most important one. Okay.
Correct.
And then I had another question. How do we, um, since our periods are can be irregular, they're either too soon or they're far apart, how can we know that anything else is going on? Like if we're having symptoms of uterine cancer or ovarian cancer, how do we know the differences between those?
Okay. So if your periods are becoming lighter and more spaced out, so
Mhm.
basically you're starting to skip months at a time, that is a typical transition into menopause, and that is not a sign of uterine cancer. If your periods were to become closer, so they're now every 2 weeks and your flow is lasting more than 7 days and you're wearing a pad and a tampon, or you're having to use the pens when you're on your period, those are signs that you need to be checked, because uterine cancer or uterine hyperplasia, which is a precancerous state of uterine cancer, can present with irregular menstrual bleeding. If you were to bleed, if you were to stop having your period for a year and then 2 years later, if you were to bleed, that's not your menstrual cycle. That also needs to be checked out, because that may be your earliest sign that you have uterine cancer or hyperplasia, which is the precancerous state of uterine cancer.
Oh, excellent. And while you're on that topic of uterine hyperplasia, what do they treat that with now? Just off the
So,
side.
no worries. So, for endometrial hyperplasia, which is the proper term, I will use that. Endometrial hyperplasia has different phases. You have the simple endometrial hyperplasia. There are 4 phases: simple endometrial hyperplasia without atypia, then simple endometrial hyperplasia with atypia, complex endometrial hyperplasia with atypia, and then complex without atypia. So each of those has a variation as to your risk of getting cancer. So the simple without atypia, your risk of cancer is maybe about 1%. Your complex with atypia, risk of cancer is about 30%. So your doctor will discuss with you, if you're a healthy surgical candidate and you have complex hyperplasia with atypia, then your doctor will most likely recommend that you have a hysterectomy. However, for a woman who is young and still actually wants to have children, because I've had patients who are overweight who ended up with cancer at an early age but wanted to still have children, we would give them progesterone therapy to help to reverse those cells, to return them back to healthy cells, so that way, if they wanted to procreate and have children, they would still have that option. But once it's atypia with hyperplasia, the preference is for you to have surgery. Unless you're medically unable to, you have too many health conditions or health problems, then it's possible that the doctor may even put in an IUD to help
Oh,
reverse the cancer cells, hoping that it'll work.
oh, I see. So I'm assuming then that we've discovered this on the ultrasound.
The endometrial hyperplasia.
Yes.
So, if a woman were to show up with bleeding, her primary care doctor, her family practice may order an ultrasound and then send the patient to us, because her lining has become thickened. So, when we are in menopause and older, your lining is supposed to be thin because you're not getting pregnant. Your lining isn't getting thick, so that because there's nothing fertilized and implanting in the wall of your uterus. So, an older woman who has a thickened endometrial lining needs a biopsy,
Oh, I see.
and the
So
biopsy will
then
let us know.
what it is.
Yes.
Okay. So then for ladies out there, if the periods are getting shorter and longer and heavier, then we should go in and be evaluated. Is that
So,
right?
so if they're becoming more frequent,
Yes. More
more,
frequent,
more frequent
heavier,
and
right?
lasting
And
longer,
longer,
yes.
right? So the 2 weeks, too heavy, right? And frequent. So in less than 15 days or something like that, then we go
Less
in.
than less than 21 days.
Less than 21 days.
Yes.
Okay. And then if they're longer and
Then 7
shorter
days.
and lighter, very good. So just repeat for clarity.
For for clarity, okay, think of it this
Yes.
way: your
Mhm.
ovaries are saying bye bye, and they don't want to work all the time anymore as you
Yes.
transition into menopause. So
Mhm.
sometimes they'll want to work. So they'll remember, oh, I'm supposed to be letting her have a period. She's still alive, and so here we go. Here's a period, and the next 3 months will go by, and the ovary will say, oh, I want to work again. Here we go, but I'm not really putting out an effort, so your lining isn't going to be that thick. So your lining is going to be that thick, so you're not going to have much of a bleed. So it's just like a little bit of bleeding here and there for a few
Okay.
days, and then the ovary is like, goodbye, I'm gone again.
Mhm.
The other side of it is too, when your ovaries don't know, your bleeding is just happening, your lining is getting thick, and so you're bleeding randomly. You're bleeding every 2 weeks. You're bleeding. Your cycle used to come once a month, and now it's coming twice a month. Your cycle used to just last for 3 days, and now it's lasting for 7 days. You used to use a tampon and be fine, and now you're using a tampon and a pad. Or one day you actually use it depends, just because that day flow is so heavy, and the other days are just a pad. Those are abnormal episodes of bleeding.
Oh, I see. And so those we should definitely be back to our provider to have them check that out.
Yes.
Excellent, very good. And then one other question with these heavy periods, and so often these women are anemic. Is there, well, I should say, I had a friend that did not want to take an iron tablet because she heard of iron overload. So she ended up in the hospital with a blood transfusion. So, is there any iron that we cannot take, should we take, using our foods, our iron rich foods? What are your thoughts on iron replacement during this period where those periods can get heavy?
So iron replacement therapy for certain conditions, if you have a blood condition called thalassemia, that's when you may have iron overload. But for the regular population who do not have that condition, you may use iron therapy without necessarily being, if you're having heavy periods, without being concerned about iron overload. And you can eat iron-rich foods like black beans, lentils. There are lots of foods, and Google has tons of things. If you just type in iron-rich foods, you'll find a list of things that will go along with whatever diet you're on. So for those who are omnivores, they may want to eat liver, and for those who are plant-based, they may want to eat black beans and lentils or have blackstrap molasses, those sort of things to help their iron levels. And the reason why iron is important is because oxygen binds to iron in your red blood cells and it's transported throughout your system. So when you're losing blood, the oxygen isn't binding to those little irons there, and so you feel you feel weaker, you have less oxygen going to your brain, and your heart is working so hard to pump oxygen because your brain and your heart need oxygen to work. And so that's why you may feel the fatigue and the rundown because you're also not sending oxygen where it needs to go.
Oh, I see. So then we are clear that really the iron overload only happens in certain disease processes, but for the average person, they can definitely take any iron supplements
Supplements.
or iron rich foods and things like that. Just
Correct.
wanted to clarify that for one of our viewers there.
No, no
And
problem.
let me not call her out. But yes, very good. All right. Any last tips before we go on menopause?
I would say number one, communicate with your partner because if he loves you, he does want to understand what you're going through. Can he feel what you're going through? No, but communicate with him. If you don't have a partner, communicate with those around you. So that way that they know, okay, this is a bad day, and they'll walk away and leave you alone, or just have a sign up for this is not a good day, so that no one comes and bothers you that day. Another thing that I found in my practice, people come in saying that, they're mad and angry and they don't know what's going on. And I have to ask them, are you mad only at your partner or are you mad at everyone? And if they're telling me that they're mad only at their partner, then I tell them you can't blame that on menopause because it's not that's a personal issue. So you, as the patient or the woman being affected by menopause, you should also be self-aware that it's not always menopause. Sometimes there are other things that are going on. And other outside of the communication, being patient with yourself because you do get through this. For the most part, most women say by age 71, 91% of women by age 71 or yeah, about 71 have stopped having hot flashes. So are you going to have hot flashes at 65? Most likely not, but there are a few that unfortunately are still going in their 70s with hot flashes. But hot flashes and the symptoms eventually do stop. And once they stop, you'll just be living your life. And you can always communicate with your doctor as to which symptoms are the worst, and he or she may be able to help you to feel better and improve your quality of life.
Mercy. I thought that this was like a 1 year, 2 year deal,
No.
but you're saying up to 65, maybe 71?
91% of people are done by 71, but 9.2% of people may have symptoms after 71.
Oh my word. This is what I have to look forward to. Oh my word. I
No,
don't know.
most of your friends are fine. Think about it. Most of your friends are fine.
Okay. Well, they complained so much of hot flashes, and I was, they're going to go through it for a year or two, but this is longer. Oh
For
my.
some people.
For some people, the average person is how long? Did you say
The average person, less than 10 years, they should be fine.
10 years? So
Less
there's no
than, less
way
than.
we can't get down to 1 or 2 years then.
We don't have the luxury of knowing.
Oh my goodness. Okay. Well, very good. It's good to know that this can be long term, and that is why the things that you said, the exercise, eating right, sleeping well, are so important, so that our life, the next 10 or 15, can go well. Very good. So let's go ahead and close. Thank you, everyone, so much for tuning in. It was a great presentation.
Thank you.
I'm not sure if we want to go with the last question. I think you answered it. What about sweats and hot flashes? That person is asking about those things. And I think you had answered that with the different replacement therapies, the exercise, going to your provider, seeing what therapies are available to you. If you want to do it naturally or with replacements are fine. And of course, always we cannot emphasize enough the importance, as Dr. Olango told us, by 30, we need to be exercising. So I'm going to also include that by 30, we're exercising, we're eating well, we're eating
Before.
balanced. Oh,
So
before
we need
30.
to make sure that we put the money in the bank before 30
Mhm.
because things start to decline after 30. So put as much in the bank.
Oh, I see. Very good. So those of us who have passed 30, then we need to jump on board. Those of us who are before 30, then we need to really invest in ourselves and how we want our future to go. Because we have an opportunity here. We've heard her talk about menopause. And so, those of us who are not there yet, we have an opportunity to change that trajectory. This whole 10 to 15-year thing is blowing my mind right now because I was really set on 1 or 2 years. So we have an opportunity to help slow it down, control it a little bit better, and do that. We have a couple of questions here that have jumped in. What about sugar with hot flashes?
I am not familiar about sugar with hot flashes. I'm
Okay,
not
so it
familiar.
doesn't make.
If someone is hypoglycemic, they may feel hot and cold. So,
Mhm.
like if someone is a diabetic and their sugars aren't controlled, they may have hot flash type symptoms, but I don't
Mhm.
know if I don't understand the question per se.
I'm thinking that they're saying that if they eat a diet high in sugar, such as donuts and sweet rolls for breakfast, does that bring on more hot flashes?
Well, I do know that women who are obese tend to suffer from hot flashes more.
Um,
So I'm assuming that if you eat food that encourages the excess weight gain, then whether it's
yeah.
Krispy Kreme or whoever, or yeah,
Yeah, because sometimes that could be a lot of simple carbs and those convert to sugar. So maybe
right.
that does encourage a hot flash. And then Anna here, she says she made a comment that I've had the hot flashes for over 20 years. I just log on and I will, okay, not quite sure what the last part meant. I just log on and I will replay. But she says that she's had hot flashes for over 20 years.
Mhm.
And folks, I'm thinking that there must be another way about this. I'm just really having an issue with this length of time of suffering. And as you put it, loss of sleep is just torturous. So I'm thinking that there must be another way. And I'm thinking that that is with what you had said about the time that we put in, the investment that we make in our health before we get there. Because once we're there, it's not going to be easy to reverse. And in some cases, it will not be possible to reverse. So we want to do that before we get into menopause so that we can smoothly go through it. There are some, I remember one of my friends, and she's about 55 or so, she's already in menopause, but she runs daily. Since she
Mhm.
was in her young adult, she ran every day, and she said she had one or two hot flashes, and that was the end of it. So
Good for
I'm
her.
thinking, right? It was good
That's
for
awesome.
her, right? So I'm thinking maybe I need to go towards that end because this
Start
whole
running.
20-year thing, right? After we log off, I'm going to need to start running and try not to have a heart attack while I try. But because this whole 20 years, 15 years, I don't even understand that. But anyway, so I like to thank you again
Yeah, no problem.
for participating here and being patient with us. We surely did enjoy having you on. Let's close with a word of prayer. Father God, thank you so much for everything that we have learned today. Please help us to put this into effect. Remind us that this is for our own well being, that your initial thought in creating us was not to keep us in menopause for 20 years with hot flashes. So please help us to find what is good for each one of us in order to prevent these things from happening and to further our lives for your glory. In Jesus' name I pray, amen.
Amen. All right. Thank
Thank
you.
you.